So let's see what we got here.
All right, we're gonna go over X-rays today and also treatment options, okay? Okay. So before we go over your test and see where you stand, let's do a little quick review, okay? Remember, we heal in 3 phases, right? The inflammation phase, the repair, and the remodel. Yeah. Remember the 4 main aspects of healing, right? If we heal wrong, we've got increased nerve sensitivity, increased number of nerves that get trapped in that scar tissue. It always feels less strong and less mobile. Yeah. Again, the treatment of therapy is to negate all that, so it heals like this, and good, and not like this, okay? So the test, okay, when you first came in, you were at a 7 out of 10. Obviously, that should be a 0. Tenderness, you were at a 7 out of 10. Specifically that L5, okay? Again, that should be a 0.
You know, remember there's 5 factors we look at when we evaluate how we interact with patients. One is personality, one is speed, one is tone, one is control, and one is the subject matter. Well, tone and speed are important, especially with certain personality profiles, especially the sanguine and the phlegmatic. The sanguine's going to have much higher speed and take off on you and take over control a lot easier if you allow them. The phlegmatic, you always have to decrease your tone and your speed. So the only thing I'm hearing right now is this guy seems a little low tone scale. In other words, they're called tone scales. And he seems like he has a lower tone scale, and Greg has a really high tone scale. So there's a great difference in tone right now. And remember, what does that mean to the patient? What does that mean in communication? Does increase in tone increase bonding and rapport? No. An increase in the difference of tone creates defensive reactions. Same with speed. If you go too fast, it'll create a defensive reaction. It's interesting, if you go too slow, it'll seem like you don't know what you're doing. But the biggest thing that I'm hearing right now is tone. There's a huge discrepancy in tone right now between the patient and Dr. Greg.
Test, you didn't have any positive nerve tests. That's good. Check that off. The joint test, you had a positive when you raised your left leg up. Okay, that straight leg raise was positive. When you twisted to your right and I bent you back, that was positive.
And just remember one minor point. Remember, it's easier to remember things to patients and people and us when you package them. Package them. What does that mean? Package them. Well, remember we said take your biomarkers. Package your biomarkers. Now, we typically use 8. If you add or subtract a biomarker, whatever it is, then do it. But we typically use 8. So say it. Say there's 8 specific tests. See, that's packaging it. When you say there's 8, okay? It makes it much easier to remember. So start delivering it as a package. When you just talk random tests, it's very hard to wrap your head around it. Say 8. As a matter of fact, you not only want to say 8, but at the end, you want to say the number that was positive out of 8. Let's say 6 out of 8 of them were positive. See, you want to say that. So out of the 8 most important tests, 6 of them were positive. That's not good. See, that's packaging. Package your tests and then give they understand 6 out of 8 is not good. 5 out of 8 is not good. See, they understand that. They expect 8 out of 8 all to be normal. And then say that. That's not good. Or if it is good, say it, whatever the case may be. But package the test. Package them. Much, much easier to remember.
Positive. Those 2 were the main ones, okay, which just prove that joint pressure in that lower lumbar spine. And again, out of all of these, this is the one I want to watch the most. This is what's going to tell how we're doing. Again, better, same, or worse. Okay. Remember the mop analogy I gave you here. Let's go to range of motion. Okay. With flexion, bending forward, you were at a 4 out of 10. When you went back, that was the worst, and that was limited. That was a 6 out of 10. Okay. And again, on this side, that's the one I want to look at the most. Okay. So to put them all together, X-ray, this one and this one I want to improve, okay? Muscle strength, you were fine.
Okay, you don't say, I want to improve. You never take responsibility for their health. Never, ever. As soon as you take responsibility, you decrease their responsibility. I've said it once, I've said it 1,000 times. You never take responsibility for their health unless you're paying the check. So that should not have sounded like, this is what I want to get back to normal. It's not what it should have sounded like. You put it on them. You put the burden and the responsibility on them, not you. It would sound like this: your. The word is your, not me or I. This is the test that you need to be most concerned about. That's what it should have sounded like, not me. Or even if you third party it, third party would have sounded like this. This test is a very important test. It's them.
Okay. Now let's look at the X-rays, okay? Before I show you yours, I want to take
One minor thing too, simplify when you give it. Just say the test. This is the test. This is normal. This was normal. This was yours. And then always say if it's good or bad. So you really have to simplify this and dumb it down. Why? Why is that? Remember, what are we covering right now? Logic or emotion? We're covering logic. Do people buy logic? No. The answer is no. We buy emotionally and justify logically. That's what we do. We don't buy logic. We buy emotion. Now, having said that, to simplify this, it would sound something like this. Now, there's 8 specific tests that tell us not only your diagnosis, if it's getting better, worse, staying the same, or if you end up with a permanent problem to some degree. The first test was your symptoms. Obviously, that should be normal. On a scale of 1 to 10, you said it was a 7. That's not good. Number 2, we checked for tenderness. Shouldn't have any tenderness. On a scale of 1 to 10, yours was scale of 0 to 3, yours was a 2. That's not good. Number 3, see, I'm itemizing them out. I'm making them very simple. I'm not going into all kinds of detail about a damn test. They don't care. They don't care. They just want to know the result. What does that mean, doctor? What does that mean? That's all they want to know. So, number 4, we checked your nerves. Obviously, those should be normal. Good news is, in your case, they were. So that's very good. Number 4, we checked your joint tests. Those should be normal. That was positive. It's not. This is a very important test. We're going to have, now you can say we, but I'm not going to say I. Now we're going to have to pay a lot of attention to that, or you're going to have to pay a lot of attention to that specific test. That test is one of the most important tests for your specific problem. So we got to pay a lot of attention to that test. We, never say I. Number 5, range of motion. Should be full and normal. Yours was restricted, bending backwards. That's not good. Number 6, muscle strength. Should have normal muscle strength. Good news is yours was. That's a good sign. Number 7, your disc base. You did have some degenerative disc base. We'll look at it on the pictures here in just a second. And number 8, you did have some misalignment in your spine, and we're going to also look at it right now, and that's not good. So out of the 8 tests, 6 of them were positive. That's not good. That's how simple and easy you would say the test and package it. Say the number 8. Say, as you go through each test, say, and remember, do the test in the order that you taught it on the board. The first 4 for day 2 and the next 4 for day 3. Go through the same order. It helps for uniformity and clarity. Next, say the number 2. Tell them the test you're doing, whatever it was, nerve, muscle, range of motion. That's all I'm saying. I'm not saying straight leg raise test. They don't give a damn about a Kemp's test. You've got to use simple words: pressure, nerves, range of motion, joint test. You got to use 8th grade words. So say the number, say the 8th grade word of the whatever it is: nerves, joint, tenderness, symptoms, disc, muscle strength, range of motion, whatever it is. Tell them what theirs it was, and then you have to tell them if that was good or bad. That's not good. If it was normal, say it. That's great. That was good. So that's a very good sign. Then when you finish, package the 8. So out of the 8, 6 of them were positive, meaning not good. And obviously, all 8 of them should be normal. See, they understand 6 of 8. They understand that. That's really easy. Package it.
What I'm looking at, okay? You see this one here? This is the lumbar spine. Yeah. This is the back. This is the front. You see the space in between here? You see this space right here?
Now, does he see space? Patients don't see space. Patients see black and white. See, we're talking to him like he knows what an X-ray looks like. He doesn't know the black space, the black part is space. He doesn't know that. You've got to tell him that. You have to say, you see this black area right here? That's space. He doesn't know space. You think he's going to say, excuse me, doctor, I never took a radiology course. I really don't know what space looks like on an X-ray. You're never going to hear that. You've got to totally think from the patient's perspective, not yours, always.
Cool. Yeah. That's when the nerves come out right there. Little space, little crown. Okay. I want you to look at that part when I show you yours, okay? See this over there? Do you see it? Yeah.
Okay.
Space.
Okay. So remember, we put emphasis on the abnormality of the problem in the normal X-ray. That's where you put that's where you put 80% of your time. 80% of your time showing an X-ray is on the normal X-ray. Specifically, what you're going to show them that's not normal when you do turn on their X-ray. That's it. That's the key to showing effective X-rays. Now, how did it sound with him? So remember, when we flip it on, we're going to say, can you see it? That's what we're going to say, okay? And then we're paying attention to multiple things. Obviously, we're going to pay attention to his words, if he says yes or no, okay? That's one thing we're going to pay attention to. Number 2 is how he says it. Do they say it with authority? Or do they say it like cautious and not sure? In other words, here's how it may sound. Can you see that? Oh, yeah. See, that is a strong indication that he definitely sees it. Not only sees it, but he sees it as a problem. Another example is you go, can you see that? I think so. No, he can't see it. See? Now, the third thing we're going to look at is their facial expression, their body language. What does their body language say? So I'm going to look at their tone, the words, their facial expression to see if they actually can see it and see it's a problem. That's all we're trying to do is get them to see it's a problem. That's it. And soon as we get that done, it's over. Okay, so he did say it. Listen to how he said it. He did say it with some authority, not real strong. But again, he said it like he doesn't read x-rays for a living, because he doesn't. He's a patient. So listen to how he acknowledges the problem on x-ray, and you determine how much authority you think he has with seeing the problem.
Do you see it? Yeah.
That was it right there. He goes, yeah, yeah. Did it sound hesitating? No, not at all. When you did ask, was there a pause, or did he come right forward? He came right forward. What does that tell you? It tells you he saw it. His words tell you he saw it because he said yes. How quickly he said it tells you he saw it. And the tone in how he saw it, you could sense a little bit of concern. All of those is what you should have interpreted, okay? Now we just want to go to confirm of what he saw.
Look at that space. You see that? Right when there's.
No, that's not what should have happened. The next thing that should happen is tell me what you see. That's the very next phrase we should have said, is when they said, when you go, can you see it? And they go, yeah. I said, tell me what you see. That's going to help you to, based on what they say again, that's going to help you determine how much they do or don't see it and to what degree. You're not going to be able to do that talking at them.
Yeah. Do you see how it's more open over here? You see that? Okay. And again, I'll put you right.
It's not how that should have been presented. It should have been presented, tell me what you see. Because I really don't have, because Dr. Greg was talking at him, we really don't have a secondary follow-up of how well he sees this and what he sees. We don't have it. And we would have had a much better idea if he'd have said, tell me what you see. Then interpret it.
Right here. And this phase one.
Yeah, just get taken care of before it gets worse.
Yeah, again, x-rays is one of the tests. Okay, this one doesn't show motion. Okay, that's why we got to take in consideration. Remember, the four negative aspects create this, and that's what started. Does that make sense?
Okay, you got to be careful now, because he jumped in and said something about the x-rays, and so we have to interpret. Remember, every time a patient opens their mouth, your mind should go to three things. The first thing you should do is shut up and listen. And then you have to interpret with what the patient is saying. Are they saying a major or a minor or just bullshit? That's what you need to interpret. Remember, most chiropractors always think when the patient opens their mouth, they always think it's major. That's how chiropractors always react. So based on what he said, I'm going to go, was it a major, minor, or bullshit? Now, what does a major or minor mean? Major or minor means need, time, or money. Need, time, or money. So he did a minimizing statement, which is very common. We all like to minimize our problems. That's natural. That's what he did. So he saw the problem and went into a defensive mode. That's normal. That's what happens. Okay? And that's when he said, well, so it's not that bad, or when Dr. Greg pointed out, let me play it again so you can hear it. But he went into a defensive position to minimize the problem. Okay? Remember, this is all how it works. This is called human nature.
We got to take in consideration. Remember, the four negative aspects create this, and that's what started. Does that make sense? That arthritis. Okay, that's what that is. Again, again, x-rays is one of the tests. And again, I'll put you right here. This phase one.
So he said, so Dr. Greg said, that puts you right here at phase one. And he said, so we're not way off yet. That's a minimizing statement, see? Okay, so now there was a decent response. because remember, the x-rays are only one of the biomarkers that determine a person's health. They're one. Well, this is one of the tests. Obviously, this is one. It's not good. So remember. All right, so let's hear what happens here. So the guy opens his mouth and says, it's so that's not. Well, we don't want to say, well, yeah, it is serious or not. Well, there's 8 factors. So was it a major or minor bullshit when he opened his mouth? Well, it was a major because he was talking about need. And what was he trying to do with need? He was trying to minimize the pain. That's what he was doing. That's what we do naturally. That's part of the natural cycle. Okay? And remember, there's always the good news, bad news. Well, the good news is if it gets back to normal, it won't be. The bad news is if it heals like this, then it will be. See, that's always the answer to clinical questions. Good news, bad news. It's based on these factors. These factors determine whether or not you're going to get better, worse, or stay the same. That's always the answer to every clinical question.
Get it taken care of before it gets worse.
Yeah, again, x-rays is one of the tests, okay? This one doesn't show motion, okay? That's why we gotta take in consideration. Remember, the 4 negative aspects create this, and that's what started, if that makes sense, that arthritis, okay? That's what that is. Again, the main things I'm looking at is range of motion and joint, but we gotta clear these up so this doesn't go this way. And also with yours, it does keep.
We got to clear these up. We got to clear these up. No, we don't. No, we don't. You've got to stop it. You've got to stop taking responsibility for them. You've got to stop it. You got to stop it. You can't do this anymore. They're the ones that are paying. You've got to stop taking responsibility for their damn health. Because when you take responsibility, you're decreasing the responsibility on them. Hell, imagine if you did that with your kids. You took responsibility for everything and they never had to take responsibility for anything. How responsible would they be? How much would they be willing to spend time or money based on problems in their life? They wouldn't. It's the same with patients. It's on them. That's not a minor, that's a major.
So,
I mean, that's like me talking to you as a client saying, do I say, I need to do this for you? I need to do this for you? You don't hear that shit coming out of my mouth because I can't do it for you. You've got to either do it or don't do it and get the results of either way. It's up to you. I can only give it to you. I can hold your hand, but I can't do it for you. You can't do it for them. It's up to them. And that has to be reinforced. It's up to them. You remember, you're showing consequences. You're showing the path, how to get to what they want. You're showing the pleasure. You're showing the pain. And you're getting the hell out of the way. It's not up to you.
Treatment options for the low back. Again, we respect patients' time and money. We have 2 policies on those. Time, we're here 9 to 6, Monday to Thursday, 9 to noon on Friday. Okay. All right. So we must have hit the speed pedal. What just happened to the speed? We just left x-rays. Watch what happens to the speed. Options for the low back. Again, this way. And also with yours, it doesn't keep coming back. Look at that speed and tone, and watch what happens. He jacks it up real fast. So before I go to your treatment options for the low back, again, we respect. That's what that was. He changed topics, and his tone and speed skyrocketed. We got to pay a little more attention to this. We got to pay a little more attention to what's called the bonding and rapport. Now, this is what happens when you enter the unconscious competence phase in a skill level. You start paying attention to these things. When you're not in an unconscious competence phase, this is what happens. You don't pay attention to tone. You don't pay attention to speed.
because you're still trying to remember what the hell to say. So you're not even paying attention to the patient's tone level, the patient's speed level. Well, these are the things that make a difference in how people feel about you, the inner feelings, and whether they create natural inner defensive mechanisms.
Patients' time and money, we have two policies on those. Time, we're here 9 to 6, Monday through Thursday, 9 to noon on Friday.
Is that fast forward or what? Is that fast forward or what? And by the way, with obstacles, generally speaking, now remember, we're talking about obstacles here, time and money. So when you cover time and money, do you think it's best to stay at the same speed, speed up, or slow down? When you cover obstacles, you think it's best to stay at the same speed, speed up, or slow down? Well, when you cover important stuff, you better slow your ass down.
We have a policy where you don't wait longer than 5 minutes to get treated, and also you're in and out of here within 10 to 15 minutes. Okay. Policy on money is we try to break it off.
Okay, so obviously up to this point, Dr. Greg's, this is day 4. So obviously up to this point, Dr. Greg's has been pretty good about getting him in and out as he's come in as a patient up to this point. Remember, if you, and how I know that is because when he covered that topic, he said, yeah, he acknowledged that, yeah, that's the way it's been. See, that's good. So remember, those first 3-4 days are unbelievably important, that when they finish writing anything down, they immediately come back and spend absolutely no time sitting there in the waiting room. Remember how important that is. Because it wouldn't have mattered right now. Remember, it wouldn't have mattered right now if he had made him wait 20 or 30 minutes and now he's saying, oh, by the way, you know, when you come here, you're not going to have to wait. It would have had no effect on him. He would have known it's a lie. So the time component has already been, in other words, how long it takes when you're there and to be seen by the doctor, that's why it's so ungodly important for your new patients have priority. This is why. So one of the 2 topics have already been imprinted on him, the time. He can get right when he comes in, he signs in and he goes back. See, that is unbelievably important. So he understood that.
The terms that work for you, sometimes going as low as 47 every other week. Okay. So let's go back to inflammation repair.
Okay, so we don't know where he stood with that. I would have said, does that make sense? I wouldn't have asked for an agreement because we're not asking for an agreement right now. I'd have said, does that make sense? Okay.
Where do you want me to get your back to?
But what a difference in speed and tone. His tone was real high, like I pointed out earlier. But once he left the x-rays, wham, it was like a freight train rolling off the blocks. And just like that question, listen to the tone and speed of the question.
Was 47 every other week. Okay. So let's go back to inflammation repair modifiers. Where do you want me to?
Hell, could you have said that any faster? Listen again. Could you have said that any faster?
Off the terms that work for you, sometimes going as low as 47 every other week. Within 5 minutes to get treated, and also you're in and out of here within 10 to 15 minutes. Okay. Policy on money, we try to break them.
That's what he said. He goes, yeah, I like that. That's how I knew he liked the time. But back to the speed. Watch how Greg is just speeding up.
On Friday, we have a policy where you don't wait longer than 5 minutes to get treated, and also you're in and out of here within 10 to 15 minutes. Okay. Policy on money, we try to break it off in the terms that work for you, sometimes going as low as 47 every other week. Okay. So let's go back to inflammation repair modifiers. Where do you want me to get your?
Holy shit! Holy shit! Were you able to hear that? My God, that was like coming down the end of a roller coaster. One of the most important questions you're going to ask. And we're just rushing through it like that. So what does that say to me? What does that tell me? I'm sitting here going, what's that say about your comfort level? That's what I'm thinking. Because usually when people are uncomfortable, they speed up. I'm going, I wonder if we're a little uncomfortable at this point in time. because this is where we're going to be talking time and money. That's what I'm wondering right now. So, but that's a very important question. So that's why that question needs to be slowed down. So based on where you're at, which of the 3 phases of healing would you like to get back to normal or as much as possible? That needs to be real slow. That's a very important question.
Back to. Okay, so you want to get through so we don't do this again?
Yeah.
So the remodel phase, would you say? Okay.
Oh, that was real interesting what just happened. And this is a very common mistake that happens. The doctors hope the patient says long-term care, and the patient did not say long-term care. So the doctor keeps talking as if they did say long-term care. That's what just happened. That is a very common problem. No, the patient said, feel better. He said, feel better. That's phase 1. He said, feel better. And you come back and inferred because you wanted and hoped. Say, this is a real common problem. You wanted and hoped he'd say, oh yeah, I want it all done. No, he didn't say that. He did not say that at all. He said, feel better. He just said inflammation phase. Listen again. And by the way, when this happens, it's the beginning of the end. When he says symptom care and the doctor automatically jumps to long-term care and starts talking to him about long-term care, like what he just did, he said remodel phase. The patient didn't say remodel phase. He said feel better. This is the beginning of the end right there. That's a paradigm shift. The paradigm shift just started. And the doctor left the patient. Now, what should have happened is and I'll come back in just a second of what should have happened. What do you do when a patient just says symptom care? See, what do you do? How do you handle that? Well, the first thing you have to do is understand that that's what they said. And he did not say repair phase at all. He said feel better. Listen carefully. I'm telling you, this is the beginning of the end right now.
Noon on Friday. We have a policy where you don't wait longer than 5 minutes to get treated, and also you're in and out of here within 10 to 15 minutes. Yeah. Okay. Policy on Mondays, we try to break it off into terms that work for you, sometimes going as low as 47 every other week. So let's go back up. Inflammation repair to remodel phase. Where do you want me to get your back to?
I still can't get over how fast that was. I mean, that was unbelievable. So let's hear what he has to say. It's not what you want.
Okay. So let's go back up. Inflammation repair to remodel phase. Where do you want me to get your back to?
He said no pain. Now listen what the doctor says.
Okay, so you want to get through so we don't do this again? Yeah. So the remodel phase, would you say? Okay.
It's not what he said. That is not what he said at all. You inferred that. You said, so it doesn't happen again. He didn't say that. You said it. This is the end of the relationship right here. This is the beginning of the end of it right here. It just started. We just created a paradigm shift right there. He broke off. What he should have realized through active listening is the patient did not say repair or remodel phase. They only said symptom care. That's flat out what he said. So we missed it. Now what will happen is Dr. Greg inferred that he wanted more care. So he's going to talk to him like he wants more care. And now the defensive positioning starts. They're in a dichotomy right now. They are not on the same page right now.
So how do you feel is based on 2 factors, our age and how long you've had something.
Okay. So we'll see what happens if he prepays or not. But right now I'm just saying it's the beginning of the end. So this is a very common problem with doctors in the beginning is they hope, and I remember, and I've told this story before. I remember when I did my very first report of finding, And I was hoping the person would say, yeah, long-term care. I mean, I can still remember the room. I can still remember the face of the patient because it was the very first report of findings. And actually, the only reason I had to do it is the main doctor that I was training under was out of town that day, or he would have done it because I still wasn't up to speed. I wasn't trained yet, up to speed. I was kind of just thrown in before I was really trained. So I was hoping I could get the guy to commit to long-term care, so I would look decent with the doctor that was training me. And of course, it didn't work. I wasn't able to get the guy to long-term care because I didn't know what I was doing. I wasn't trained. But I'd hoped the guy said, yeah, long-term care, but it wasn't. Okay, so the first thing you've got to do is you got to be highly aware with your active listening skills of what they really did say. That's the very, very first thing you have to do. So what we should have recognized right away is he said feel better. He said symptoms. I don't know how to explain any better when somebody says feel better that that's symptom care. I don't know how else to put that point across that when somebody says, yeah, I want to feel better, that they just said symptom care. Okay? And in other words, the inflammation phase. So so let me go into what do you do when this does happen? Well, what you don't do is what we just heard. Act like they said more than what they did. That's what you damn well don't do.
Hey, Paul, can I interject here for a second?
Yeah.
So I know we know that the pain stops before the remodel phase, and I do get this a lot. I don't have them say, when I ask that question, they don't say, yeah, I want to get through the remodel phase. They'll say like a symptom-based answer, like, yeah, I want to feel better or whatever. But with this gentleman too, I truly believed he thought the feeling better was in the remodel stage. Now, whether that's a patient education problem.
Well, I'm not discounting what you said at all. What I said is you didn't hear him. I'm suggesting that your responses are true, but they're not true to the reality of the situation. They're true to you.
Well, when he said I wanted to get out of.
But let me stop right there and finish this topic, okay?
Okay.
So he said symptom care. So when he says, I want to feel better, where in any of your mind would you think that meant all three phases of care when he says, I want to feel better? Feel better is symptom care. Feel. Okay? So you have to be real clear about this distinction. Now, and by the way, this is one of the reasons we did the preemptive strike. Remember, right before we offer them this, we do the money and time preemptive strike. And the reason we do that is we found that when we didn't do that and the patients did not know a bare minimum of time or money, when we would ask them which of the three phases they wanted to get back together, a large percentage of them could not commit to all three phases because they didn't know the cost. So when we put in the preemptive strike with times, especially money, when we say it can be as low as X every 2 weeks, the payments, we increased the prepay percent. It was like 32%. It went up. It was a dramatic number because now they knew the money that was involved to be able to answer that question. But let's get back to this situation because this is a very common scenario from the patient standpoint and a misinterpretation from the doctor's standpoint. So he said he said feel. Okay. Now, how do you handle that? Well, the first thing you have to acknowledge is that in no way represents three phases of healing. In absolutely no way. It's feel. And you got to remember that's what that's what all patients know anyway. When they're not educated, all they know is how they feel. So as soon as he said that, there should have been a red light gone off. You go, oh, he did not say all three phases, and I cannot talk to him like all three phases. In other words, you had to stop right now you cannot go forward. And then you had to go back and clarify. And so what should have happened right now, as soon as he said, I'll feel better, the very next thing out of your mouth should have been, so which of the three phases, in other words, I need to get clarity. So out of the three phases of healing, are you telling me you only want to go through the first phase? Is that what you're telling me? Because the first phase is the symptom phase, pain and inflammation. My point is, you gotta realize they did not say, I want rehabilitation. That's the very first piece of the puzzle. The next piece of the puzzle is you got to go back and clarify. That's the very next thing you have to do. So even if you say, I'm confused, which of the three phases? In other words, make them say it. And by the way, this is one way to clear it up. Make them say the phase. Now there's no misinterpretation. Make them say remodel phase. Okay? That's how you can clear all this up. So if they don't say, inflammation repair or model, then you come back and say, ask them again. So which of the three phases would that be? Would that be the inflammation phase, the repair, or the remodel phase? That's what should have happened next. Now, if indeed in this guy's mind, like you said, his mind was that it was all three phases, and you came back and challenged him and put all three phases on the plate, then he would have naturally picked the remodel phase and you would have been right. But you can't make assumptions like this. Matter of fact, it's not even an assumption, it's flat out wrong because he said feel. He said feel. So, all right. So now I'll just share with you typically what will happen. So first recognize this cannot happen. You cannot have you can't be talking about one type of care when the person didn't agree to that type of care. You need to understand you can't do that. You will immediately lose the patient. Okay? So you have to be at the same spot the patient's at. What does that mean? So if they don't answer you specifically, you got to come back and ask them again to get specifics. And that's what the next phrase would have said. I would have recognized that as the person not accepting all three phases. And I'd have said, so which of the three phases is it that you want? Do you want the inflammation? In other words, I want him to tell me, as a matter of fact, because he said feeling, I'm going to go into the negative part. I'm going to do, it's called reverse negative talking. In my mind, when he said feel, we're in the inflammation phase. And I would have went right into reverse talking. So let me understand this. You're telling me you only want the first phase to feel better and you're not interested in the repair or the remodel phase. Is that what you're telling me? That's what it would have sounded like. That's how clear, that's how crystal clear it would have been. Now, if in the person's mind he wanted all three phases, then he would go, oh no, I want all of it back to normal as much as possible. See, now I would have brought it to the surface and we would have our starting point. See, you don't have a starting point right now to go forward. Well, you do have a starting point, but you missed it. His starting point was inflammation. Yours was repair and remodel. So that's the very first thing you need to do is say the words. And if they don't say the word, then you say it again and ask them to say the word. Which of these, inflammation, repair, or remodel? Have them say the word. Okay. Now I'm gonna go one step further here and go, what's the solution when they do say, by the way, it's really unusual now. You got to realize that when somebody says they don't want all three phases of care, you got to realize what's the real problem. Well, usually, especially after we did the preemptive strike with money. So the real problem right now is still typically a money issue, and that's why they don't commit, or they don't think they can get better. They know it's a permanent problem to some degree. You'll have that. You'll have some patients who will just say, you know, the inflammation phase or whatever, and they won't pick all three phases because they know they have a permanent injury. Okay. The third reason is trust. They don't trust you. Those are the three reasons the patient will overwhelmingly, when they don't commit. In other words, after you've educated a patient on the three phases of healing and the ramifications of it, what sane human being would not say, yeah, that makes total sense. I want to not only get back to normal, I want to decrease the likelihood of a permanent injury. You see, any sane human being would say that if there were no obstacles. So if they still say that, at this point, you're typically dealing with one of three issues. One, the obstacle is still there, or you didn't communicate it properly. They still don't understand the cause and effect relationship. That wasn't communicated. That's one. Two, money's still an issue. Three, they don't trust you. Those are the three reasons. So let me go in, take just a second and go, what do you do when the patient says, you ask them which of the three phases, and they literally don't want all three phases. And let's say it's not about that they can't get 100% better. In other words, they think they have a permanent problem. Well, what do you do? Well, what do you have to do? You got to now separate out need and obstacles. You got to go back and separate out the obstacles from the problem. And you have to try to, and the reason you have to do that is you have to see, do they actually understand the need part, or is it an obstacle problem? And so how you do that is you separate them out. And this is how it's done. So let's say in this case, the person sticks with feel. So I come back and say, well, which of the three phases you want? He goes, I want to feel better. And I go, so you're telling me you only want the first phase? You're not interested in the repair of the remodel phase? And he goes, yeah. Let's just say that for sake right now. Now I'm going to come back and separate the solution from the obstacles. I'm going to say, tell you what, if you don't mind me for just a second here, let's just put time and money aside. I understand time and money is always, a concern when you're dealing with health problems. But if you don't mind, let's just put that aside and say that's not an issue right now. Now I'm going to come back and reinforce and see if he agrees with the problem, with the consequences. Are we in agreement with the three phases of healing? And you see what happens in the repair phase with the two negative aspects of the nerves and the two negative aspects of the scar tissue with increased sensitivity, nerves being trapped in scar tissue and to decreased elasticity and strength. Are we in agreement in that, or is there any confusion in that? Oh, no, I understand that. See, now, if he doesn't agree with that, that alone is a reason for them not to move forward. And typically, if they're not in agreement with that, it's a trust issue because they don't know any better otherwise. They just don't trust you. And that's a whole nother issue. So I'm going to come back. I want to separate out money and time, and I want to come back and go and get an understanding of the three phases of healing and an agreement. So can we see how that happens? Can you see how this is what will happen with your neck to some degree? Okay. So if that's the case, then it sounds like money or time would be the issue. Does that sound like that's right? In other words, what would be the reason you would not want to get all three phases back to normal? See, that's what it would sound like. And now you're back to money and time because that's where it's at. Any common sense person that understands this process would say, yeah, I want to, unless they think A, they don't trust you, A, B, money or time is still an obstacle. Those so it's trust, or they don't believe what you told them, or it's money or time. That's what happens. But I will tell you, okay, and then what do you do then? And they stick to it. And they go, well, no, it is, I just want to feel better. That's all. What's the goal now? The goal is to get a commitment to the first re-exam. That's, in other words, when the patient doesn't agree with anything, always go for the shortest amount of treatment to the first re-exam. And so it would sound like this. So, okay, I understand that. I'll tell you what we can do is in your case, what we would do is just treat you 3 times a week to your first re-exam. And basically in 3 to 4 weeks, we would redo all these tests, all 8 of these tests. And they would tell us if you're getting better, how much you're getting better, if you're getting worse, you're staying the same, or whether or not you're headed toward a permanent injury. In other words, I'm going to shorten it to the smallest possible unit. What's the smallest possible unit? The first re-exam. See, because that makes sense to people. Well, how about if we just went to the first re-exam, redid the test, and that'll tell us exactly how you're responding and healing with getting better, worse, staying the same, or ending up with a permanent, or if you're headed toward a permanent injury. Would that work for you? That's what I'm always going to go for with the person who just wants symptom care. In other words, they don't go for it all, okay? All right, so let's get back to where we're at with this person. So he says symptom care. He says I wants to feel better. Greg does a very common mistake, doesn't acknowledge that it's in the feeling part. He's going to assume the guy thinks it's repair and model. Matter of fact, he forces it on the guy. Instead of getting the guy to say it, Greg says it. And then he tries to get the guy to say it by saying, so let me understand this. You want to get the remodel phase and get it back to normal? Well, I want to ask you a question, Dr. Greg. How many people are going to have the confrontation to say no to you right now? That's why it's not about you. It's about them. The question should have been an open-ended question to them and ask them again, which of the 3 phases do you want to get back? And in his particular case, to me, it was a slam dunk. In no way did he say anything about the repair or model phase. Everything about the answer feel was about inflammation. And so I would have went right in there and said, so let me understand this. You just want to feel better. You're not interested in getting your back through the repair phase or the remodel phase. Is that what you're telling me? That's what it would have sounded like. And I would have created clarity. One way or the other, we're going to create clarity because I cannot move forward. If he's only on the repair phase, I can't talk to him about the remodel phase. If he's only on the inflammation phase, I can't start at the repair phase. We have to start where they're at. And the only way to do that is go in there with a second resistance, itemize it out, menu it out, and go for clarity. Get them to say the damn word. That's the key right there. Get them to say the word. That's the key for any misunderstanding. So if they don't say one of those words, ask them again. So which one of these do you want to get back to normal? I just want to feel better. I understand that, Mr. Jones, but which one of these phases do you want to get back us to help you with? The inflammation phase, the repair, or the remodel phase? Which one of these phases, Mr. Jones? That's what it would have sounded like. That's what it would have created clarity. And then wherever he's at, that's where I got to go. If he's on inflammation, that's where I got to go. If he's on repair, that's where I got to go. But I can't just talk to every patient like they said remodel when they didn't. You thought they did.
Repair stage takes anywhere from 5 to 10 weeks, and I want to see you 3 times a week. Okay, now I'm going to put the lower end on you.
I want to see you. We got to stop this shit. We got to stop this. I want to. We got to stop it. What's a natural reaction when you pull somebody in? Go ahead and pull your kid in and see what kind of natural reaction he gives you. They push away. You're creating a repulsive reaction when you say, I want to see you. That's from weakness. It's not from strength. It's up to them.
5 weeks, so 3 times a week, that's 15 visits. Repair.
But I'll just tell you right now, it's over. And because he never said repair or remodel. So we're in 2 different planets right now. And Greg doesn't know it.
Takes anywhere from 7 to 20 visits. Okay, again, if we take 7 visits, here I'm seeing you also treading once a week to once every other week, by the way. It's more focusing on strengthening the spine so it doesn't come back. So again, if we take 15 visits at the repair phase, 7 visits at the remodel phase, that's 21 total visits. That's how I come for visits, okay? Now let's go to the cost, okay?
You see, where was he at? We didn't hear anything. We have no agreements from him. Does that correspond with being on two different planets, on communicating on two different levels? See, that's another sign that you're talking on two different levels. He's on the symptom, you're talking repair. You're talking at two different levels right now. And that's just another sign that he's not with you because he doesn't even answer. He's not even responding. He's left you. He's already fired you.
So this is how we break it down. You had a $47 copay. Okay. So at 21 visits, the total charge is $987. But we,
You know, it's kind of hilarious when you're really good at your active listening skills and all this stuff. This guy already fired him, and Greg doesn't know it.
we give you a prepaid option of 20% discount. So 20% off this brings it down to $789. Okay. Now 21 visits, I approximate will take around 20 weeks. Okay, so if you buy 20 into 2, you get 10 payments. Does that make sense? So 10 into 789 comes to 780.90, and we would bill you every 2 weeks. Does that work for you?
Yeah. I just, it's really hard to get tired for 1 week.
When you start work?
Okay, let's see what he says again. I didn't hear him.
21 visits, I approximate will take around 20 weeks. Okay, so if you buy 20 into 2, you get 10 payments. Does that make sense? So 10 into 789 comes to 780.90, and we would bill you every 2 weeks. Does that work for you? Yeah.
Okay, I'm surprised. That totally surprised me that the guy's going into agreement now. And that with the money. Now he comes back and throws the obstacle of time. Okay, let's see how this is handled.
Just, it's really hard to get up here 3 times in 1 week.
When you start work?
I start at 7:30. That's why I gotta like stop and come up here at 9, 7 midnight. So, I mean, I can get up here. I just, some weeks during the repair state, it might take me a little longer because it might be 2 visits in a week because it's super hard for me to get away in the morning.
Well, you're doing good this week.
Yeah.
So he's saying how it may be hard for him to get up there 3 times a week. Are we just going to let it go? No. We're going to go into second resistance. We want to find out when he goes into work, when he gets off work. We're going into second resistances. And then we're putting emphasis to do everything he can 3 times a week to the first re-exam. The most important part is 3 times a week till the first re-exam. See, that'll make sense to him. The first re-exam is a target. A target. Targets are important.
What is that?
Here's what I would like to do. I would really like to push yourself just for your night step again. I know you got stuff to do, and that's why I respect your time. I know you own your own company. You got a lot going on. I get that. So, yeah, but I would just tell you, really try to get, if we can at least do another 2 weeks.
Okay, that was a good phrase. So the guy owns his own company. So that was a real good statement to say, I know you're going your own company and you're busy. That was a really good statement because it decreases their defenses and they go into agreement. Now, by the way, this is Greg's 3rd resistance. I want to point this out. He did not quit when the guy first said, I don't think I can make it 3 times a week. He didn't just say quit. Okay, check it. Just check with Mary at the front. No, he's fighting through it right now. This is skill level. This is active listening and skill level is what's going on right now. So he's in the 3rd resistance. He got when he goes in, when he gets off, and then put emphasis at 3 times, how important 3 times a week is, at least until the first re-exam, because the first re-exam, we're going to redo all the tests, and that's going to tell us if you're getting better, worse, staying the same, or headed toward a permanent injury. See, targets, we all want targets in life. All of us respond to targets.
You say 3 times a week, okay? And then I'll start working with you right now. Yeah, for sure. Just sure. Yeah. Okay. Yeah, that's why time and money, if it's not money, it's time for folks, so we have to measure and idea with everything going on. So like I said, schedule typically for next week, starting with Monday, again, best would be Monday, Wednesday, Friday, okay, break it out like that. But like I said, if something changes, or if you free up in the afternoon, again, we're here till 6. So if something frees up in the afternoon.
Yeah, he didn't, even though it's the third resistance, he didn't get an agreement with the guy. There's not an agreement of when he's coming in before and after work. There is not an agreement. In other words, we didn't get the guy to alter his schedule to where he could maybe take off work a little early to get here on time. But there's not an agreement. The guy has stayed with his obstacle. So you always want to go to an agreement, even if it's a short-term agreement. Short-term, what's short-term? First re-exam.
Please come back. And also too, Trey, just to be honest with you, I can have you in out here in 5 minutes, really. And once we get past that inflammation phase, you just need that adjustment.
And sometimes I'm like in Nashville, like I said, so like at least once a week I go to Nashville. So like during those.
You drive past my office though, right?
Outside of our I mean, it's not a big deal.
Yeah.
Which we like to take the trace home, but if I'm.
Okay, remember, you're always sticking with the model. It's the biomarkers relative to the 3 phases of healing. And one thing I always told patients, I say, here's the bottom line, patient. The more treatments you get in a shorter period of time, the quicker you feel better and heal. The longer period of time it takes, and you spread out the treatments, it takes longer to feel better, takes longer to heal, and you can end up with a permanent injury. It's up to you. See, that's what it sounds like. In other words, it's back to reality. It's back to care and reality. That's not my wish that he come in 3 times a week. It has nothing to do with me. It has to do with his damn physiology, the physiology of healing. That's where the emphasis always is.
Okay, sure. That way, like if I have to get some morning in the morning.
Yeah, I would have pushed for a short-term agreement until the first re-exam. That's what should have happened right here. To get him 3 times a week. And emphasized the importance of the treatment relative to the test, and at the re-exam we'll know how he's responding. And if things are going well at that point, we'll definitely be able to lighten up the schedule. But the treatment in the beginning, the frequency of treatment definitely is going to have an effect on how you start to heal.
When we go to Nashville, we leave at like 6:30. So sometimes I have to go with them. Sometimes it's like a never know.
I understand. So schedule events again the next 2 weeks. Now remember, Trey, on the 12th visit, we're going to redo these. We're going to do, remember, these are the most important: range of motion and the joint test.
Okay, good. Now he's coming back around. I would have brought it up quicker. And it sounds like it's more superficial. You got to drive home third-party objective findings with a timeline. Everything about patient education is third-party trust timeline. Everything. It's the test at the re-exams. That's what determines everything. Are you getting better, worse, staying the same, or are you headed toward a permanent injury? That's everything about patient education.
Those are the ones I want to see improve. Okay. All right. I'll have Mason.
And again, those are the ones I want to see improve. That's not the language. We've got to stop this. I put it on them. So what would that have sounded like when I said his test? When I said, now, out of those tests, the compression test and your range of motion test, those are the 2 most important tests that's going to determine whether you end up with a permanent injury or not, how those heal. See, that's putting it on them and a pain-based motivator instead of no motivation and putting it on me when you say I. You got to stop the I shit.
Schedule out up front and take the first page. Okay. Yeah. All right, sir. Have a good week. I'll see you on Monday.
Okay, so that was a really interesting analysis. In my mind, that guy was not going to prepay. So he did prepay, so that's good. But get the patient to say the word. Now, he said feel. So in my mind, I think Greg got lucky because he said feel. An easy way to do it is get the patient to say the word. If they don't say the word, ask again. Get them to say the word. That's how, in other words, inflammation, repair, or remodel. That's how you'll know where you're at with no ambiguity at all, okay? Now, that was a real interesting analysis. It was interesting in that, you know, the phase of where Dr. Greg's at relative to learning, in some of these areas, you can see he's definitely in a state of unconscious competence. And in some of the areas, he's still in a state of conscious competence where he's still having to think. And it's kind of back and forth depending on the topic. So let's go through the 5 categories. We already talked about personality. We talked about speed and tone. That was real important. Hopefully, Dr. Greg understood and was able to hear that his speed, and that's when he went into the unconscious competence phase, or the conscious competence phase, when he just sped up like that. But pay attention to that. Those things matter. Those things matter. I mean, I'm a high tone person. I'm an alpha male. I'm an alpha choleric. None of my patients would have known that. I know it's hard for you to believe. None of my patients would have known that because I'm a chameleon. When I went into that room, I was a chameleon, and it depended on the personality of the patient. If I had a passive phlegmatic with low tone scale, my ass dropped down. My tone dropped down. My speed dropped down. I was not ignorant going in the room yelling and screaming like I am now. Okay? Okay, so speed, tone, we talked about that. Control, he definitely was in control, didn't let the guy go anywhere. Content, he covered the content pretty good. I would just tighten up a few of the loose ends. One of the things we talked about already was when you cover the biomarkers, package them, say 8. And then when you cover them, don't go and say the damn test. Don't say Kemp's test, straight leg test. They don't give a shit. They don't even know what that is. Say words they know. Range of motion, nerves, tenderness, symptoms. See, they know those words. Your joint tests. See, I'm not going to say Kemp's test. I'm just going to say, because you got to use 8th grade words. So I would do a much better job packaging those 8, saying there's 8 specific tests. I mean, this just needs to be reinforced, not just in day 1 through 4, during the regular visits, the re-exams. It's 8 tests, 8 tests, 8 tests, 8 tests. 8 specific tests that are going to tell us how well you're getting better, worse, staying the same, or may end up with a permanent injury to some degree. You just need to get used to saying it. Third-party trust with a target. Everything about patient education is third-party trust with a target. That's everything. Then, and then itemize them out. Number 1, what it is, what is it? What should it be? What's theirs? And then tell them if it's good or bad. Number 2, say the number. Number 2, okay? That makes it really easy to go through quickly and easy to understand. Okay, enough of that. We covered the x-rays. He did pretty good with x-rays, except the second part of the x-rays when he said he should have asked him, what do you see, instead of telling him. So in the first part of it, he did good, and the person did see it. So that's good. We commented on that. When he went into the preemptive strikes of time and money, that was way too damn fast. Way too damn fast. Then we went into the 3 phases of healing. That was good. And I already commented on the patient saying feel better. That does not mean anything to me but symptoms. And you have to get clarity. You got to be on the exact same page. How do you do that? Get them to say the word. Well, which one of that would that be? Would it be the inflammation phase? Would it be the repair or the remodel phase? Get them to say your word, and that way you know which phase to talk about. And then I talked about if they don't say, oh, I want to remodel, I want to get back to normal, you know. If they don't pick that, then I went into how to handle that. You got to you get the agreement. If it's not there, then you got to go in and separate out the logic versus the obstacles. Make sure you're clear on the logic, then come back to the obstacles. But I said, usually when they don't, if the communication is there, remember the average person will take the time out and spend the money because we make it affordable, remember? And we're pretty efficient with time. So there's no reason for the average person to say, no, I don't want all 3 phases. I want a permanent injury the rest of my life. There's no reason. So almost always, number one is they don't understand the consequences of healing. You didn't do a good job of that. Number two is time or money is still an issue. Or number 3 is they don't trust you. Those are the 4 most common reasons somebody will not say, get back to the remodel phase after you've asked them if you did everything right. So on a scale of 1 to 10, if Greg's an associate doctor in my office, how am I going to grade him? I'd easily say that was a 7. I'd want him to tighten up a few things here and there. The big thing I already pointed out with the feeling, I think that can go bad fast. If he keeps reacting that way without them saying the specific word, the communication can go bad fast. The I part, I mean, that's just got to stop. There's just absolutely no room for that. None of this is up to you. None of it. It's all up to the patient. And the more responsibility you take, the less they take. You're hurting the relationship and hurting the likelihood of the patient taking responsibility the more you say I. You got to stop saying I for the treatment protocol. So, but on a grade of 1 to 7, I'd say 1 to 10, I'd say 7. And then I'd be looking to tighten up some of these. The biggest thing for me, if I was going to do a little tightening up on this, is I would work on getting him to get the patient to say, when he asks him, one of those 3 words: inflammation, repair. If they don't say one of those 3 words, ask them again. And you say the word. That's probably the biggest thing, because that'll stop a lot of confusion, potential confusion. That's probably the biggest topic of what we heard today that I'd be concerned about. But outside of that, I'd say on a scale of 1 to 10, I'd say a 7 if he was my associate doctor. Any comments or questions relative to that? And then just one last thing. Remember to always focus, like him with the treatment schedule and all that, put tremendous emphasis on the re-exam, the treatment schedule, and the bowel markers. Put tremendous emphasis. Third party, objective, target. Trust. Trusted third party, that's the bowel markers and the 3 phases of healing. Third party trusted source, target, re-exam. That's what everything about patient education is. Always put the emphasis there.
Hey, Dr. Paul, I had a quick question.
Yeah.
We spend a lot of time in day 1 getting their ADLs, and you always say that's their prime motivation. When is there an opportunity to bring that up or even include that as part of the test during a day 4? When does that aspect come out?
Well, that's part of the bowel markers. When you're covering the bowel markers, you covered the symptom, the ADL, and then you went through the bowel markers. That's what should have happened. In your report of findings, you did a quick review. The very next thing was going into the bowel markers. Remember, ADLs are bowel markers. You covered his chief complaint. You covered the intensity, all that, frequency, duration, all that. Then you should have covered the ADL, just like you did in the consultation. And then from the ADL, you should have went through in the same order that you were teaching the patient education. You go from symptom, tenderness, nerves, joints. That's the first 4 for day 2. Then you go into range of motion, muscle strength, disc, and the x-rays. Those are your 8. That's day 3. And that's the order we'd have just walked right through. But right at the symptoms, after you covered the symptoms, just like in the consultation, after you cover the symptoms and the frequency, you're going to cover the ADL, then go into the test. But yeah, you should always emphasize that ADL. Remember, there's always 3 words that you should always say when you're interacting to a patient. What are those 3 words? Number 1 is their first name. Number 2 is their primary chief complaint. Number 3 is their primary ADL. Those are the 3 words that they should always be hearing from you every time you interact clinically with a patient.